Hello, my name is Haiyan Xiao. I'm a DNP student. I'm going to perform a musculoskeletal neuro assessment on my patient today. I closed the door for his privacy and had my hand washed. So first I will have a general inspection on his standing posture. So his standing posture is normal. I did not see any deformities on any on the upper and lower extremity and spine. And then do you have any pains or any concerning today? Then could you please walk front and turn? Could you please walk on your heels? And could you please walk on your heels? And could you please walk on heel to toes straightly? And to bend your knees straight. And then could you please bend one of your foot and hop? Okay, change to the other side. Okay. Put your 2 feet together. This is Romberg's sign. Close your eyes for 60 seconds. And his body only have a very tiny swing. So this is correct. So it's a negative sign. Then let me check on you. Okay, so you can relax. Yeah, put them apart. And then I will check on your neck, shoulder, elbow, wrist, and finger joint. So put your chin to your chest. Look at the ceiling. Put your ear on your shoulder, side to side, and look at your shoulder. And put your ear on shoulder. Oh, you have it done. Okay, so that's good. And then your shoulder up, down, outside, inside, and put your one hand on your next shoulder, and then the other on to the next shoulder, and pull your hand to the back to touch the blade, and the other side. And okay, you feel any pain for those? Okay, and then bend your elbow, extend the other side, and then move them upward, inward, and the same side. Okay, and then put your hand, keep your palms down, and then put forward your hand toward the ceiling, downward to the floor, and then inside, outside. Outside. Did you feel any pain?
No.
Okay, make a fist and open them up big, very big. Open up. Okay, and then let me do you feel any pain those? Okay, let me palpate on this your joint. Any pain?
No.
Okay, and your hand looks normal. And also, I did not see any redness or swellingness, and did not touch any masses or lesion. So palpate is normal, and you have full function about those. And then also, let me check a carpal tunnel syndrome. Put your hand press back together and make a 90-degree at least. Did you feel any pain or tingling? Okay. And then let me press your medial nerve. Any pain or tingling or numbness? This side. Okay, so this syndrome is negative. Then you can have a seat, please. Let me look at your check your DTR. So it's bicep. The contraction is good. It's a 2, normal, and the brachial radial use this. Okay, the contraction is 2 is normal, both of sides. Bicep, good. A normal response and patella. This one, good. And then the Achilles. Good. Good. So your DTI is correct, and then I'm going to check your muscle tone. First, back on the triceps. Push me, okay, and grab me, okay, and then I'm pressing you against it, and I push you up. You resist it, okay, good, and your grip, yeah, what? Don't let my fingers go and keep it tight. Okay, muscle tongue. Okay, so those muscles five, they are normal, and then going to um, I'm going to check your cortical sensory function. So I'm writing numbers on your hand. Let me know what I write. Okay.
5.
Yes, close your eyes, and then this one.
7.
Okay, great. And then we're checking your sensation. So this one is soft, soft and sharp. Okay, I'm sorry. So close your eyes. Let me know it's soft or sharp.
Soft. 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 Sharp. 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 Soft. 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 Sharp. Sharp. Soft. Soft. Sharp.
Okay. Could you please use your fingers and touch your nose? Open your eyes first. Do several times, and then close your eyes and do several times. Okay, that's good. Um, okay, and then I'm checking your cranial nerve. Cranial nerve one. Open, close, breathe in and out. Okay, and check your smile function before. It's good. Cranial nerve two. It's your vision, and we were supposed to do the Snellen test. I was that you did the 25th part from the Snellen chart, and they will check you which is the smallest numbers you can see, and check your vision, and then also then let me check your 3, 4, 6 cranial nerve, and then you keep your head still. Follow my fingers. Okay, and then again. Okay, those cranial nerve are intact, and then cranial five. Please clean your your teeth. Maybe okay. This is the masseter muscles, temporal muscles, and they're good. They're normal. And then cranial nerve five is intact, and then the cranial nerve seven. Could you please close your eyes tightly and smile? Open your eyes. Smile. From. Pop out your cheek. Okay. This seven is intact, and then cranial nerve eight is checking your hearing. So I'll include one the ear, do the whisper test.
9, 10.
Um,
5, 6.
So cranial nerve eight is intact, and cranial nerve nine and then 10. So first your speech is good, and then can you swallow?
Yeah.
And also, could you please open up your mouth and say ah? Okay, so you will lift up and in the middle, and then so those two intact, those two cranial nerves are intact, and then cranial nerve 11. Could you please shrug against my resistance? Okay, and move your head side to side. Okay, so cranial nerve 11 is intact, and cranial nerve 12. So could you please stick out your tongue and then move side to side? Okay, so this function is intact. And then I'm going to, could you please lie down? So I'm checking your hip, your knee and ankle and foot, the joints, and also the quadrip and those and and those muscle tongue. So first, let me check those muscle. I'll push, give some. I will push your put my hand here on your side, and you lift your that against my hand. Okay, good. This muscle is a 5. It's normal function. And then I will put my hand under the knee, and I push down, you against my hand, okay? And I'm pushing up, you against my hand. And do the other side the same. Push down, you against, push up, you against. Okay, good. The muscle tongue is 5 is normal. And then you use your foot against my hand. Good. Again, yeah, push against, and pull against. So the muscle tongue is 5 is good. And then I'm checking your joint and your hip. So your flexion, extension, and move upward and inward. Did you feel any pain?
No.
Okay, the other side, hip, upward, inward, flexion, extension. Good.
Yeah.
Okay, knee, same thing. Flexion, extension, upward, inward. Did you feel any pain?
No.
Okay, the other side. Okay. So, and then your ankle. Could you please move, upward and toward that side, and then upward, inward. Did you feel any pain on your wrist?
No.
Not wrist, ankle. I'm sorry. So okay, so this is also intact. You have your joint and everything is normal. Um. Oh, could you please stand up? I have stay down. I have one thing I forgot to do. Put your hand on your side, and then sit there and do this. Okay, and close your eye. Do the same thing. Okay, so your side tapping is correct. So that's it for today. Thank you very much for your help.